Wow. Good evening. I am your poster person for skin cancer. You name it, I have had it. Like I said, I grew up on Miami Beach getting one blistering sunburn after another. But 55 years ago, who knew what the effects of the sun rays would be? Well, about 7 years ago, I went to a dermatologist for a rash on my face, and I said to her, do me a favor, check out this little pink dot that I have on my arm. I think it's a basal cell. Yeah, that's what it is. Let's take a biopsy. She called me at the office, at Dr. Elliott's office, and said, are you sitting down? I have news for you. You have a melanoma. But not to worry, it's in an early stage. We're going to catch it. We'll take care of it. So I went into her office. She did the excisional surgery, sent it to pathology, and it didn't come back so good. The margins were not clean. It was invasive, and now I had to go to a real surgeon. So, of course, when you have cancer, it's not just about you, it's about your family. Because in your mind, you're thinking, what am I doing to them? You know, you want to go on with your life and try and make like everything is normal, but in the back of your mind, it's not. So I went to the surgeon. He did a wide excision on my arm. First, I had gotten another opinion. The other doctor said, same thing, wide excision, you'll be fine. Did the wide excision 7 years ago, followed it up by CAT scans, PET scans for about a year and a half. You're clean, no problem. Well, my husband and I were in Las Vegas having a great time, and I was getting a little discomfort under my rib cage. So when we got back home, I went to my primary care physician, and I said to her, do you think you can order an ultrasound? I'm feeling a little discomfort. So she ordered the ultrasound. I went to where I used to work, the radiology center. Immediately after the ultrasound, the radiologist came in. He said, Harriet, there's something in your liver. Let's do a CAT scan right now. So I drank the garbage, had the CAT scan, and he said, I think you've got a met in your liver, and I'm pretty sure it's a melanoma. So I looked at him and I said, Dr. Mattern, how many people have we seen throughout the years? The scenario is the news isn't usually good after that. So he said, no, not to worry, go back to work, call the doctor. I called the doctor that did the original surgery on my arm, and he wanted to cut me open from one end to another and, you know, get in there and see what was going on. I said, nah, I'm not going to do that. So when I went to work, I said to Dr. Elliott, who do we know? Can you call Dr. Michelson at St. Barnabas? Dr. Michelson got on the phone and said, I want Harriet to see Ann Pavlik at NYU. My husband and my daughter brought me to NYU. I saw Dr. Pavlik, immediately loved her. She's calling in her surgeon, Dr. Elliot Newman, and he's like, you know what? I can go in laparoscopically, clip the top of the liver, and get rid of this. So that's what he did. It was quite an adventure. I felt like one of our patients that was having a mastectomy or a sentinel node biopsy, because this is how our patients always felt at the breast center. The fear that you feel, the unknown, what am I doing to my family? How's this going to affect my life? Get me off this table so I can go back to work and help our patients where I belong on the other side of the desk. But, so the news was good. He got it. Everything was fine. I was scanned, MRIs, CAT scans every 3 months. Unfortunately, within 14 months, my husband and I were again in Las Vegas. Don't think we're big gamblers. We like the shows too. So we were in Las Vegas, and I felt some discomfort under this rib cage, and I was like, we went in October, and 3 weeks later, our one daughter was getting married. And I said, I don't want to do this to her wedding, so I kind of snuck in, saw Dr. Pavlik, did a CAT scan. I had just had a CAT scan before we went to Vegas. There it was, something tiny wrapped around the portal vein between the pancreas and the liver. So I said, can you cut it out after Jennifer's wedding? And she called the surgeon in and he said, no, we can't go in and cut this out. This is too dangerous. So we waited till our daughter got married, which happened to be 2 days before Hurricane Sandy, went through the whole scenario. Unfortunately, my daughter's mother-in-law at the wedding was dying of brain cancer, lung to brain. So she passed away 3 months later, and I sat at the table and I thought, wouldn't this be something if my daughter lost her mother and my son-in-law lost his mother? But that wasn't to be. So Dr. Pavlik said, don't worry about it, I'm gonna put you on Uravoy. Now, Uravoy, you get 3 doses every 3 weeks. Well, the first dose wasn't too bad. I went home, wasn't feeling great, had a problem taking my dogs for a run. The stomach issues started, the fatigue started. I had the second dose, I was really feeling crappy. After the second dose, I was scanned, no change. Went in for the third dose. By that time, I was pretty much crawling in. I lost about 40 pounds. Went and she said, you know what? We're not going to give you the 4th dose of this because it's not working. But there is a clinical trial out of something I want to put you on. Now, this was in March. I started the clinical trial in July. Now, in between this, my husband and I and our cousins were taking a cruise, and I said, I'm not going to let it stop me. This isn't going to run my life. I don't care if I have to be in the bathroom all the time. I'm going to enjoy this. And we did. And when I came back, started the clinical trial, I have a port, and it was every 3 weeks. I got the infusion. It's called PD-1. That was almost, July will be 2 years. Within the first time I was scanned, this tumor shrank 65%. So I was like, and I said to my husband, I'm feeling like a human. You know, get the tiki bar out, let's have a barbecue. This is great. Listen, I got to put my priorities in order. We had a new grandchild, we have another one on the way now, and another one on the way. Our girls reproduce like rabbits, it's crazy. So what happened was I've been on it every 3 weeks for 2 years. I was just scanned 3 weeks ago, right, Bob? 3 weeks ago. Dr. Pavlik calls me and she goes, are you sitting down? Now we're getting ready to go on a trip the following day to Aruba, and I'm sweating. I'm like, okay, I'm sitting down. She goes, I don't even see any. There's nothing showing up on your scan. There's not even schmutz. All right, that's great. I can continue to eat. But, and I said, what's the but, Dr. Pavlik? And she said, you have to go in for surgery. You have a hernia, which I had already known, but it got to the point that it's affecting the other organs. So I went in last week. My husband brought me in to NYU, saw the surgeon, Dr. Shaw, and the first thing he said to me was, are you having trouble breathing? I said, no, I get a little winded when I climb stairs. And my husband said, but she's on the treadmill every morning. He said, your colon is up in your chest cavity and you have a hernia the size of a melon. Oh, that's nice. In other words, what you're saying is, I'm not going to have a 4th of July barbecue. Let's get it straight. He said, well, I don't know about that, but we need to operate. You have 2 other hernias also. So I am now scheduled for surgery on June 30th. One of our daughters is due to have a baby July 9th. And I said, my husband will be in this hospital dropping me off and in the other hospital making sure that she's okay. I mean, it's crazy. But you know what? You have to take life and enjoy it. You have to. You can't let it run your life. In my mind, when I was first diagnosed, I said, wait a minute, this is 10 days, 2 weeks away from Memorial Day. I've got a big barbecue at our house in Cedar Grove, New Jersey. Am I going to be able to cook for it? And the doctor said, well, you might be. He was very stuffy, New Jersey doctor, very stuffy. He said, you might be able to, but you're going to need help. Okay, do the slice and dice, the sentinel node biopsy, the chunk taken out of my arm. Do it, My daughter helped me with the barbecue. My other daughter came in. Everybody brought stuff. We had a great time. So you know what? This hernia surgery is not going to get in my way. Maybe not for 4th of July we'll have a barbecue because we might have a new baby instead. But what are you going to do? Now, when anybody asks me if I'm wearing a sleeveless top, what happened to your arm? You've got a piece taken out of your arm. I tell them the truth. I was down in Myrtle Beach with my husband and our cousins. I got attacked by a bull shark, and that's it. That's it. It's great. It makes for a great story. Enjoy life. Remember the people that are no longer here. I just had a friend that passed away from melanoma because she did not get the care immediately that she needed. I'm sure we all know people that have passed away, people that are ill, people that are doing great. You have to enjoy your life. Right? Thank you. Thank you. And go out to dinner tonight, too.